we really see a wide variety of cases, a lot of things that you wouldn't necessarily see at smaller community programs we do get here just because of the size of OU.
Our experience here clinically is incredible. We always joke that we take care of some of the sickest patients in the country, and it really is true here in Oklahoma. We have a diverse patient population that has a great number of comorbidities, and sometimes it can be very challenging.
So we have a large adult tower, which actually has just been added onto in the recent years, and so brand new rooms, large sizes, big operating rooms. The VA is also on our campus and connected with the Sky Bridge, so we're able to also serve the veterans of Oklahoma as well here. The Children's Hospital, likewise, is a large modern hospital that takes care of the majority of Oklahoma's pediatric patients.
Because we are the only children's hospital in Oklahoma, we have like all of the subspecialists here and thankfully get to work with all of them.
No one does their job alone in residency, but I think the GME, as a whole, does a good job of providing opportunities for residents from different specialties to commingle, whether that's in a social setting, whether that's through leadership opportunities like resident council.
I think the benefit of working with multiple disciplines as you're learning and growing is it gives you a wide breadth of information for patients. You're getting to see how this patient is taken care of from multiple angles and how multiple people are approaching a patient. We can always learn a lot from each other.
I think Oklahoma City is unique in that you can do all of the things you want to do and pay for it very easily and still be able to do all of the things outside, like going out to dinner or going to the movies, those kind of things. Lots of residents in my program have children, if not one, two, and are able to send their kiddos to daycare and still be able to come out and do all the things with us all the time.
Oklahoma City has been an amazing place with amazing people, and that's why I'm staying. Psychiatry is very much in demand, so I could go anywhere that I want to, but I just really like the people here.
Being able to provide care in a team-based way to patients that really need it there and now is incredibly rewarding. And again, I think it goes beyond the care of that individual patient that you may be treating and really being able to impact a whole generation of future patients and potentially even learners as well.